There was a previous year question about the HIV, so explaining and reading the most important points of HIV topic from the HIV topic. Okay, this is the box doc, and you are at the Cortex Medicine channel. So, what is the definition of AIDS? You can remember, advanced stage of AIDS represent advanced stage of HIV infection and defined critically by a CD4 count of less than 200 cells per mm cube or presence of one or more AIDS defining illness. So the question was about which of the following is the AIDS defining illness? Okay, which of the following is not a AIDS defining illness? शायद ये question था. Hmm. So one question about more that when the AIDS happen, when the opportunistic infection are appears. Okay, so if you see, we will tell a patient to be HIV positive, but when we say AIDS positive, when the CD4 cell count is less than 200. So in the question, the typical time was asked about this, and if you see by this, it is the 200 here, and if you draw this line here, it will come around 10 years. So 10 years is the around the time when symptom appears, appearing disease in appears in the patient. Okay, if you see. Okay, there was a question in the previous year. Okay, so next we will read about the main point that there was a question in previous year also that the patient is given if clinical question is given asked that it is the pneumococcal pneumonia or it is the TB or it is the zero SI, and as we know that zero SI is the most common infection, most common lung infection that happen. Most commonly matlab lung infection that we always associated with HIV. That's why we always answer that it is the GVSI that patient has, but this is wrong. The incidence of pneumococcal pneumonia more than TB and more than GVSI in the AIDS patient. Okay, and in the pneumococcal pneumonia the consultation of pH in one of the lungs is seen, but in the GVSI there are bilateral perihilar opacity. If you see this line bilateral perihilar opacity, you can make the diagnosis of pneumocystis cerevisiae, and by the chance by the luck at that time the bilateral perihilar opacities was mentioned at that in that question. So all uh, the candidate answered the pneumocystis cerevisiae and it is the answer. But remember always, if nothing is mentioned about pneumocystis cerevisiae, you have to answer always pneumococcal pneumonia. Okay, if TB, you know about the TB, multiple spore present in the both lung. Okay, if parallel is present, it favor diagnosis of zero SI, and the beta 1,3 glucan test is positive and LDH is also elevated. Management is cotrimoxazole. May stop prophylaxis. CD4 count is more than 200, and IV pentamidine if allergy to cotrimoxazole. So drug of choice is cotrimoxazole. If someone is allergic to cotrimoxazole, then the drug of choice will be IV pentamidine. Okay, and steroid if PaO2 is less than 70 and alveolar minus arterial gradient is more than 35. Okay, extrapulmonary manifestation zero size aortic mass on axial meatus, lymphic node enlargement, hepatosplenomegaly, lesion in the choroid. Okay, there can be a chance of this question 2025 HIV target. Okay, what should be less than 10% and what should be more than 95%. Okay, people living with HIV, we call these people PLHIV. Okay, so less than 10% people living with HIV and key population race, stigma and discrimination. Okay, make it less than 10. People living with HIV, women, girls, and keeping experience gender-based inequalities and gender-based violence, make it less than 10. And less than 10% of countries have punitive laws and policies. Okay, make it less than 10. What we have to do? More than 95% of people at HIV use combination preventive. uh, Combination prevention actually. We always say that if we are using a protective measure during the time of intercourse, you always have to do double prevention, है ना? Either condom or anything else, protection or anything else. Okay. The 95 strategy, you all know that 95% were HIV tested, 95% of the treatment, and 95% those will be among viral suppressed. Okay, 95% of women access sexual and reproductive health service, 95% coverage of service for limiting vertical transmission. These are the 95, 95, or two 90s are there. 90% of people living with HIV receive preventive treatment of TB, and 90% of people living with HIV and people at risk are linked to other integrated health service. Okay, remember these 90 and 95. This is a PSM question. What is important that it is also a PYQ. Okay, so I told you one PYQ, I told you one PYQ from here. Okay, and I told you one PYQ from here. Okay, 3 PYQ from HIV. So what are the drugs that are effective against HPV also and also to HIV? Also to HIV. So remember by this trick, let me treat the HIV and HPV. L for lamivudine, E for emtricitabine, T for tenofovir. Okay. What are the most sensitive tests? What are the most sensitive tests? EIA, and most specific test is Western blot test. Okay. So a CD4 count is given, and what are the possible cause of infection in that patient that can infect? In the less than 500 it's cause TB. In less than 200 pneumocystis jirovecii is the common. Less than 100 cerebral toxoplasmosis is common, and less than 50 CMV retinitis common. Okay, this is also a common question. This is also a common question. Just I have uh, a brother. Met in the garden, and he has illness anxiety disorder. Okay, so he always asks when he met a HIV girl or HIV boy, he asked me that I touched her sweat or I touched his sweat, so I be exposed to HIV? Okay, so HIV is not infected or not exposed or not spread. You can say not spread by tears, sweat, urine and feces, saliva, sputum and vomitus. Okay, you will always confuse by sputum, okay, saliva and tears and sweat. Remember this, unless until there is no visible blood, or unless until there is no visible blood, these are not infective. Okay. What is the risk of HIV infection? HIV infection maximum in the risk of blood transfusion. L second, it is the perinatal. The okay, means from mother to child, and after that it is from sexual intercourse, vaginal, maximum, anal, and oral is the least, and there is injection drug use as you saw. Okay. When to start ART? Nothing. Whenever you see a patient is HIV positive, remember, regardless the CD4 count, what is the preferred regime that is changed into around 2021? It is a TLD. The remember point, you have to remember that there is a dolutegravir. It is a 50 mg only, less more. Rest two are 300 mg. Okay. What is rapid ART initiation? ART initiation within 7 days from the day of HIV diagnosis. IRIS is a syndrome when someone takes the immune response is hyperactive, so patient get many features. Okay, so this is IRS, mostly seen with TB medication. Okay, what is advanced HIV disease? Advanced HIV disease in the 5 year of child, any younger than 5 year child, okay, is considered HIV disease. But in adult and adolescent, if CD4 count is less than 200 or WHO stage 3 or 4, it is the advanced HIV disease patient. What are the HIV regime in the pregnant and breastfeeding? It is the tenofovir, lamivudine, and dolutegravir. It's same TLD. It is same for intra labor patient. Someone is labor postpartum or intrapartum patient. It is also the same TLD if received ART before or not. Okay. When to give cotrimazole prophylaxis? Actually, we do the double standard cotrimazole prophylaxis in the patient, and give in the adult patient more than 350, and in the pregnant when its CD4 count is less than 250 or equal to 350, WHO stage 3 or 4, and stop when the CD4 count crosses it. What are the in the infant born to HIV patient? What have to when to start and what to start in the low risk patient? Okay, low risk patient means the viral load in the mother is less than 1000, and it done after 32 week of pregnancy up to delivery. Okay, we have to start syrup nevirapine. Remember this syrup nevirapine, but there is a exception about the syrup zidovudine, that in situation where nevirapine will not be effective, as mentioned. What are the situation? If patient have confirmed HIV 2 or HIV 1 plus 2, okay? If infant born to a mother who had received earlier nevirapine, or their patient is on the protease based ART regime, okay? In these patients, you have to start zidovudine or lopinavir or ritonavir, but you have to answer the nevirapine, and remember second option zidovudine. 3 terms for the zidovudine in the low risk infant, okay? Duration from birth till 6 month of 6 week of age. Okay, for the high risk infant patient like infant born to HIV positive mother not on ART, 32 वीक के बाद मुझसे वायरल लोड टेस्ट नहीं किया है. Okay, और वायरल लोड सप्रेस ही नहीं हुआ है 32 के बाद भी पेशेंट के अंदर, और मदर न्यूली आइडेंटिफाइड HIV पॉजिटिव है पोस्ट नेटल पीरियड के अंदर विद इन 6 वीक ऑफ डिलीवरी के अंदर, इट मीन्स कि ऐसा भी हो सकता है कि देयर इज अ चांस दैट इट इज इन्फेक्टेड बिफोर द ड्यू बिफोर मीन्स व्हेन द मतलब बेबी बाहर आए उससे पहले भी इन्फेक्टेड हो सकती थी, वो ऐसा भी हो सकता है। सो द ऑप्शन फॉर द ड्यूल प्रोफाइल एक्सिस निविरापिन प्लस जीडोबिडिन, रिमेंबर जीडोबिडिन दिया जा सकता है। ओके, ड्यूरेशन यहाँ पे याद रखनी है, ड्यूरेशन की एक्सक्लूसिव ब्रेस्ट फीडिंग करवा रही है पेशेंट तो आपको 12 वीक देना है लॉन्गर। रिमेंबर लॉन्गर क्यों देना है आपको 12 वीक की, देयर इज ए चांस कि कोई लेडी ब्रेस्ट फीड करवा रही तो इन्फेक्शन होने के चांस ज्यादा है मदर टू चाइल्ड, दैट्स व्हाई इन एक्सक्लूसिव ब्रेस्ट फीडिंग you have to give the dual ARV prophylaxis for the 12 week. But if it's the replacement feeding, change feeding means bottle feeding, you have to give from birth till 6 week of age. Remember, for here for the either replacement feeding or the exclusive breastfeeding, you have to give all the patient to 6 weeks of age. Here it is 6 week and 12 week. Remember this. I explained it before. What are the age defining illness? This is the PYQ. Okay, now remember trick. They remember this candida of esophagus, not the mouth. They confuse in the candida of mouth. Okay, you know pneumocystis jirovecii. You know this. You know this. You know this. You know this. Okay, toxoplasmosis brain onset is more than 1 month. Pe NCMV retinitis, you remember it. Cryptosporidium, you remember it. Coccidiomycosis, you remember it. Kaposi sarcoma, it is the remember. What are the they can ask which cancer? It is the Kaposi sarcoma, lymphoid interstitial pneumonia, lymphoma, Burkitt lymphoma, or immunoblastic lymphoma, lymphoma primary of brain. Okay, these are the 8 defining illness. Okay. Okay, this I think I covered most of the important points from the AIDS. Okay, thank you. Keep following, keep loving.